Well, Jacqueline, the bacteria is being labeled as the nightmare bacteria. According to the CDC, as you mentioned, there were 10 cases. We don't know where, but we do know it can be deadly with seniors and people with chronic illnesses.
It's the latest superbug that's out there.
It's always scary for those patients that are in the hospital and have resistant infections.
Dr. Vilma Vega of Can Community Health has seen an increase in bacteria getting harder to fight.
There are cases where they have no other antibiotics that we know of, that at least our common power drugs, they don't work against these bugs.
The CDC says these antibiotic-resistant germs could spread like wildfire. Vega pointing to constant exposure to antibiotics as to why bacteria develops a resistance. She says antibiotics should only be used when they're needed.
You limit your use of antibiotics, and that is especially true of physicians who prescribe them, but also for patients not to be immediately going anywhere and asking for certain antibiotics. Patients, if they could get infected, especially if they've been on a lot of antibiotics.
Doctors Hospital Lab Medical Director John Averett agrees, saying these strains of bacteria are acquiring resistance over time. So once a patient has it, it's difficult to treat. Those who are older or with a weaker immune system are more susceptible.
These cases are generally people that have been in the hospital for a long time. They're immunocompromised for various reasons.
And there's a protocol that is immediately put into place in the event their hospital admits a patient with this bug.
And it includes isolation, includes, diagnosis, obviously, and certain treatment protocols.
Bottom line, says Vega, it's all about washing your hands frequently and not being in a state of panic.
And we can't live in a state of paranoia. We have to obviously just recognize that we try to stay as healthy as we can.
Now, we did reach out to the Florida Department of Health to find out exactly what they're doing to help, but they have not responded to our request.